Trying to figure out how to work was crazy because nobody knew how you could see patients again, and everybody was freaked out of seeing anybody. So everything kind of ground to a halt.
First started to collect our thoughts and start thinking about what next steps will be for Brockville General Hospital, because the focus was that Brockville General Hospital also had to be as prepared as the big city hospitals.
At the beginning you figured out maybe it'll be a couple weeks or a month, we don't know. And then you're like, okay, well, it's gonna be a lot longer. So you had to figure out how to adjust and figure out how to make your clinics work and work with the hospital to do things safely.
We have physical barriers that have been put up since the start of the pandemic to try to keep our staff safe. You'll see everybody's wearing masks around. We've set up limits to the amount of people that are allowed to be in common areas like the cafeteria and meeting rooms to keep spatial separation for everybody. We are screening everybody on arrival to the hospital to make sure that nobody's coming in with COVID-like symptoms, and if they have those symptoms, they're being dealt with right away.
We've had to pivot multiple times. Everything from, we didn't used to process the assessment center swabs, but the delay in time to get results was too long. So, we pivoted back before Christmas to take on that work and process them here and send them off for testing. To testing for the variants of concern that is happening now, and making sure all those reports get to the right places.
Take all the information that the government and public health is giving us, figure out what that means to BGH. What does that mean to each and every one of our departments? What does that mean to our patients? What do we need to communicate out to the community so that they feel safe and trust the work that we're doing to care for their loved ones? I'm trying to synthesize all that information and make sure that it's relayed and articulated in a very simple, clear-cut fashion and pushed out to people. So twice daily, 3 times daily, 7 days a week, emails going out to folks on the front lines especially, so that they knew what they needed to do to keep themselves and our patients safe.
Well, it was definitely a collaborative venture amongst many partners in our community. There were many hands to get things going, and we literally did it within a week. It still remains very much a collaborative effort among public health, Brockville General Hospital, primary care, the Upper Canada Family Health Team, and the City of Brockville.
Very relieved, like a weight is lifted after this past year of just caring for patients with COVID or suspected COVID. I think it's important to get vaccinated because you may not be susceptible or at a high risk of having a bad case of COVID, but those around you, your family members, your friends, they could be at a higher risk, and it's just important to protect those around you as well as yourself.
It feels absolutely amazing. It's the thing that we've been waiting for, and it's so exciting to be starting it for our staff and being able to vaccinate my peers and my friends, and getting everybody's first dose. So it's super exciting. It's been probably about a week solid of a lot of people working behind the scenes and getting stuff set up, setting up the physical location, booking in the staff. We had some training this morning with public health to make sure we were all up to date on the systems that we needed to use and what we had to specifically do with handling the COVID vaccines.
We're so excited. I just feel like the energy is so positive right now that, we've all been worried about this vaccine for so long and having access to it, and just the fact that it's here and we're being a part of, drawing up the vaccines and administering the vaccines, and we feel great, and the staff are just, you can just feel the energy in the air. Everyone is just so excited. We've been waiting for this for so long. It's emotional.
Thank you to the community for being patient with us. Thank you for the community for following all the restrictions for public health. And thank you for the community to help our staff.